it's Nicole Sheehan, integrative veterinarian with 6 Opinion Stories. I'm here with an update on Olive. Olive came to me after seeing a few vets, having MRIs done and things like this for her fecal incontinence. So she's got a couple of problems. One is she acutely lost her vision about 18 months ago. Nobody really figured out quite why that happened. And then she's got fecal incontinence, which means she poops and she doesn't quite know it. So she's had MRIs done. Nobody can really figure out what's wrong with her. And in her first exam, I found very clearly she had some pain in her spine, right back here, which is where the nerves feed the colon. And so that's what we're treating with acupuncture. So far, this is her 3rd treatment. She feels better. One of the things I forgot to mention in her first video was that one of her other symptoms is that she has chronic rear limb lameness. So she comes up lame on her right hind, and nobody's ever been able to pinpoint where that problem is. Well, the sciatic nerve also comes right from this location and feeds that leg. And so often when I get discomfort in this area, I will see fecal incontinence, but I also see rear leg lameness. And I'm happy to report after 2 acupuncture treatments, no pain medicine or anything like that, she's walking better. So they're noticing that she's not lagging on her walks and things like that. So really happy here. We also, after her 2nd acupuncture treatment, reduced her Imodium that she's on for fecal incontinence down to every other day, and we haven't had any accidents. So I'm excited to check her out today and see how she feels. And then also, I'm probably going to keep dropping down her medicine. So let's just go through her spine. I'm going to go through all her points. And if you remember from her first exam, all of these were fine until I got back to her colon points. And she is still sensitive. So after 2 acupuncture treatments, I'm still getting that little flinch right in that spot. So I'm glad she's responding, but I would expect her to make more headway than she is. So for me, I've been doing acupuncture for so long, I have really consistent results. If I'm not getting results as quick as I want, it actually means she needs chiropractic back here, which might sound crazy, but if she had some kind of injury to her pelvis where her pelvis shifted, acupuncture will help, but then the muscles just kind of want to pull that pelvis back out of position. And so I'm going to treat her with acupuncture today because it's working, but what will happen is if she continues to react in this location, we're going to end up right back where we started, 3 months, 6 months from now. And so if that's not what I'm going for. I'm not going for temporary results. We're going for cures here. So what we want to do is get a permanent fix here, not a temporary fix. So I'm going to go ahead and put her acupuncture needles in, and then we are going to have her see our chiropractor. So we have someone come in who adjusts out their spines, who's certified to do that in dogs, and he will get her adjusted, and then I'll see her again after that and see if that did the trick. So here goes for needles. And you'll see animals actually do really fantastic with acupuncture. They don't have needle phobia like we do. I do have maybe 1 dog out of 10 who doesn't enjoy having the needles, in which case I have an acupuncture setting that I use on our laser machine, and we will do it that way, so we don't actually have to poke them. Olive seems to do fine, as you can see. She's barely fazed by it. And if you remember, her sensitive point is back here, and so I'm going to start kind of around that. I'm going to work my way back to her most sensitive spot. Right here are some kidney points. Kidney points are good for any dog that has arthritis. She does have a little tenderness there too, which is interesting. That probably has to do with the muscles that run along from the area that she's painful in. And then this is her main spot. Let's see that twitch. If a dog does not have a problem in that area, you will not see that twitch. So that means there's still something going on there. That's her other colon point. And then I'm going to do a local sacral point. So right where that sciatic nerve runs. Good girl. That's perfect. So that's it. Easy peasy. So she will have to sit tight for about 15 minutes. We'll pull them out. I'll see how she feels, and then we'll get her set up with a chiropractor for her next visit. Thanks so much.